All right, how's everybody doing today? So today I wanted to kind of build on some of the conversation that Jala has started in a couple of her videos. So she talked about reimagining the value of the SIU, which is somewhat of the groundwork or foundation of what we're trying to push this year. So we really have seen that, we're kind of boxed in the SIU and not just one organization, but across the board, where we feel like we really need to take those steps and elevate the value that we bring to the organization, kind of free the SIU, elevate, the perspective of what we bring to the table and the value that we can contribute to the organization as a whole. And so inviting that conversation with these other departments, there's a couple things that you want to keep in mind. One, keep in mind their priorities are different from yours. And so unfortunately, sometimes we are seen as poking holes or not being adversarial to other departments. And that's really not where we're coming from. And I think if we approach it from the standpoint of, hey, this is our expertise and this is our priority, and it doesn't conflict with yours, what it does is it balances with these other departments. And so we bring a perspective. We're looking as a fraudster, right? We look for loopholes where other departments, your claims are looking at turnaround time and processing and numbers and volume, where clinical areas, whether that's care management, utilization review, medical affairs, whatever that might be, they're looking at patient care. And what happens sometimes is when we're thinking about volume or we're thinking about patient care, what we do is we pull out some of the hiccups or the obstacles for members, thinking that that's that's working in their best interest, but that's not always what's happening. And if they thought like a fraudster, which we don't want everybody to think like a fraudster, but we want to bring that to the table. We want to bring to the table the fact that we look at these different things. We've seen these things happen where individuals take advantage of these. And so we want to bring that to the conversation. So the conversation might look like, hey, for COVID, we're all living in that world right now where we're seeing claims and things are shaking out, and we're finding whether or not we can stand on anything for some of these cases. So if we put a policy in place that says, yes, you can do this, that's going to make our job much harder to mitigate those risks and to find cases that we can take action on. And so we really want to invite that conversation to the table to make those changes. So it's a little late now for pre-COVID conversations, but it's a really good time to bring those things up and say, look, have we thought about it? Have we brought in the SIU and our perspective or payment integrity, our perspective to the table? We might have done things differently. So keep in mind when you're at the table that you just want to say, hey, have you thought about this? Have we thought about how this ramification might impact the casework and recoveries and even prevention of potential FWA in the organization? So have those conversations, invite them into the conversation, invite yourself into other people's conversations, and let's free the SIU, elevate it, and let's show everybody exactly what the contribution is that we make to these organizations at a much higher level.